Amy Chen, the stage is yours.
Thank you. Good afternoon. It's a real privilege to be here, to share the stage with my incredible fellow scholars, and also just to be amongst all your company and have a few minutes to talk about something that I'm really passionate about. So Tom and Nitsa and Kim, thank you for an incredible conference and the opportunity to be here. It's been a fascinating last couple of days thinking about inequality and some of the challenges that our country is facing and just the magnitude of those. And if you're like me, you left feeling like, oh, I want some really concrete solutions. Well, what can we walk out of here doing? And I'd offer this up humbly as one opportunity for us to consider, thinking about this intersection of business and social impact, or really more broadly, thinking about how you drive social impact wherever you are, whether you're in academia, in government, in nonprofit, public policy, any field. I think that there's a real opportunity for us to think creatively about how we increase and really innovate in this space. So what I'm going to share with you over the next few minutes is something that I could talk about for hours and would be happy to do so. But my hope is just to give you a taste of the journey that I've been on over the last few years, and one that I would say has been the absolute privilege of a lifetime. So what you see behind you are pictures of some of the initiatives that I've run and have been at PepsiCo over the last 5 years. It's one of the world's largest food and beverage companies, and it's got Pepsi, which you know the name on the door. It's got Frito-Lay, but Quaker, Tropicana, and increasingly a very big focus on health and wellness around fruits and vegetables, dairies, and grain. So for the last few years, I had the privilege of essentially creating, building, and evolving a social business incubator, something that's kind of like a skunkworks startup inside a $60 billion company. And what you see here are pictures of everything from an urban farm, which we converted from a dilapidated football field in Texas, which, if you know football, is kind of like a heresy, to a program that's a mobile meals program that delivers healthy meals to kids who don't necessarily have great access to food during the summertime when school's out of session, to an innovative sort of startup program where we teach local community members who live in so-called food deserts, where there's not great access to fruits and vegetables, and equip them with the tools to sell their own fruits and vegetables and to become change agents and educators in their own community. So what I'm going to tell you about is the story of how this got started, and hopefully there'll be some inspiration for how you can do something similar in your own context. So not surprisingly, the first step is figuring out the spark of an idea, and I think the beauty here and what's been really encouraging to me is that it doesn't have to be fully formed, it doesn't have to be the pearl that comes out of the oyster, it can be really rough and crude and messy. And what I found is, at least in my experience, the best ideas are born out of your own personal experiences, your personal passions, your personal interests, your backgrounds, all the things in the meandering past that each of us have taken that culminate in something that we can uniquely address, something that we're uniquely passionate about. For me, I've had a really diverse academic and professional background. I went into consulting straight out of college and knew that I loved business. I loved the creativity, the innovation, the potential, and sort of the limitless boundaries of that. But I also grew up in a family, an immigrant family with very modest means, and was still instilled with a very strong passion for social justice, and sort of a deep commitment at my core that part of my purpose on earth was to give back to those who didn't have the privileges and didn't have the opportunities that we've been talking about over the last couple of days. So I spent some time in government, working in Washington, D.C. on homelessness and housing policy. I worked in nonprofits. And I found really quickly that I loved the mission spirit of those organizations, but I missed the discipline. I missed business. So that very quickly became sort of my passion, my professional calling, if you will, which was thinking about how you bring those two worlds together. So when I was at Stanford and looking up opportunities, I happened to talk to a lot of folks from PepsiCo and heard about a really innovative, creative CEO who wanted to change the world, who had a vision that you could have performance and business and profit and all of those traditional metrics and marry that up with purpose and environmental and community and human sustainability. And I started thinking, well, this might be a really interesting place to try out some ideas. So that's what I did. I joined the company and started thinking about, well, what could I do? What's an idea that I could really help bring to life? And I started thinking about my background, the company, our increasing focus on nutrition, and said, well, what if we could create an incubator within the company that was sort of on the bleeding edge of innovation, thinking about how a big company could do things totally differently, but also thinking about how we could do things in a way that engaged our communities in a really meaningful way. And not in traditional philanthropic terms, where we just gave charitable outputs to nonprofit organizations. But what if we could actually take the engine of business and create revenue-generating business models that could drive social impact? Now then you'd really be onto something. So I started working nights and weekends and kind of scribbling out this business plan. And after a couple of months, I had a pretty well-formed idea. And then I thought, well, what's next? So then the selling began, and I can't tell if you guys can see this. It's a little girl talking to her dad who's at the computer and says, Jessica has an idea about going to the beach that she'd like to pitch to you. So it's a cute illustration, but it's really about selling. So I took this business plan, and I showed it to my manager, and I said, well, PepsiCo's been talking about all this health and wellness innovation and how we want to transform business, and I think I have an idea that I'd like to pitch. So I shared it with him, and he said, gosh, I have no idea what to do with that. Why don't you go talk to HR? So I went to go talk to my HR manager, and I said, hi, I'm Amy. I've got this crazy idea about how we can do things differently and create this social business incubator. What do you think? She's looking at me. She's like, gosh, I don't know what to do. She's like, I don't think I can say no, but I definitely can't say yes. So I kept on getting passed back and forth to various people around the company, and finally someone very senior up decided that the only person who could really decide was the CEO. So I found myself sitting in front of Indra Nooyi. So here's me, a little employee straight out of business school in a company of 300,000 people, and I get to pitch my idea to her. So, I was working furiously, creating all these slides, and had all these arguments ready for why we should do it when she said no. And she, sat down. We talked for a couple minutes. She's like, I think it's a great idea. What do you need? I was like, oh, wow, I had not expected that. I said, let me come back to you in a few weeks with a more concrete plan. So it just goes to show you don't know what you can get if you ask. So then I had the CEO's green light, and I had done all of the data digging. I mean, all of us in this room are incredibly good at analytics and at understanding the facts and the numbers, and I knew them like the back of my hand. The numbers, the staggering numbers of Americans who are living in poverty, who are dealing with incredible difficulties, who can't make ends meet. I also knew about a lot of the challenges in inner city communities around health and nutrition, around obesity, around diabetes, and all of these factors that compounded. But what I didn't know was what it was actually like to be in these communities. And I thought that before I could actually create a business model or start getting new revenue streams and creating these crazy innovations, I really had to spend time in the field. And this is where Tom was talking earlier about education and what it looks like for us to understand the facts versus going into a classroom and talking to kids who are really struggling in the system. And I would encourage you really to get out into the field. And it's amazing what happens when you take these data and these numbers and these facts, and then you see them through the lens of a person who's struggling with them every day. It's an entirely different story. And I just give you one example as an anecdote. So we were thinking about health and wellness. We're a food and beverage company. Nutrition is right up our alley. So that was kind of an area that I was interested in exploring a lot. And talked to a woman, and I said, well, what does health and wellness mean to you? We essentially just parked it in community centers and churches for 6 months as listening sessions or town halls to get a sense for what the pulse of the community was. And I thought, okay, there's all these statistics on diabetes and hypertension. Like, here's a mom. What does health and wellness mean to you? She said, I went to the doctor 2 weeks ago. She said, I had just this most horrible experience, and I walked out of there crying. And I said, well, what happened? She said, the doctor told me that I was overweight and at risk of diabetes, and that if I didn't significantly change my lifestyle, then I wouldn't see my kids grow up. She's like, there's nothing more devastating to a mom than to hear that. And so she begged the doctor, and she said, well, what do I have to do? I'll do anything to change this around. And he said, I've got a really simple prescription, just 2 things. First, I need you to eat more fruits and vegetables. Simple enough. And secondly, I need you to walk more. I need you to exercise. I need you to be active. And she said that's when she really lost it in the doctor's office, because she was sitting here thinking about this incredibly simple prescription on the one hand, but then thinking about the reality of her life. She didn't have a car. She worked 2 jobs. There was no grocery store nearby, and fruits and vegetables were more expensive. She didn't belong to a gym. There wasn't one in her neighborhood, and the streets weren't safe, and there were no sidewalks. She's like, that's what health and wellness means to me. And that's what I'd really encourage you to get into. Like, get into the grittiness of people's lives and the stories and what that data translates into real life. So we started, and after these conversations, had a pretty good sense that there was a real crisis going on with nutrition and health and wellness. And we said, well, where do we start? And I loved Hala's kind of exhortation about dreaming big, but I'd encourage us all to start really small. And we said, well, to the community, we know that these problems are massive and huge and have compounded over generations, but where do we start? Someone said, well, one of the issues that just breaks our hearts every day is that we can't get kids food, and that kids who normally rely on free and reduced price meals during the school year don't have access to good food during the summertime because they're scattered, there's no central place for them to gather, and they're going hungry. And they cited all these crazy statistics about kids were falling behind in school and all these other things because of those issues. So we said, well, that's one that we can tackle. We've got one of the world's largest distribution and supply chain systems. We've got great logistics. We've got great expertise. We know how to get food. Like, let's get going. So in the course of 6 weeks, essentially, we hobbled together a system to essentially test the hypothesis of whether if we brought food out into communities, would kids come? And you can see some photos here. We were literally running out of igloo coolers with ice in the middle of a 110-degree summer in Dallas, so it was a mess. But we learned what we needed to learn. And that's really been sort of the philosophy that we've had from the start, informed very much by design thinking and IDEO, if you're familiar with them, but just this idea that you get scrappy. You get as quick of an answer, as messy, and as cheap as you possibly can to learn what you need to learn. And along the way, what you'll realize if you take that approach is that you're going to fail a lot. This is one of my favorite cartoons. It says, don't tell them we failed, just tell them that we decided to temporarily postpone our success. And I found that this has been absolutely true in my world, because each failure, each thing that didn't work, each hypothesis that turned out to be false was absolutely critical for us to improve the next iteration, for us to get from point A to point B faster, cheaper, smarter, and for us to be able to, in the course of the last 3 years, go from a couple hundred meals on the back of a truck to a fleet of 50 trucks across 4 cities that's delivering 1 million meals to kids. And so that is the process. That's what I think is absolutely beautiful about innovation, about just getting started, and about making a difference where you can. And in closing, I'd leave you with one of my favorite thoughts from possibly one of the best innovators, imaginators, magicians of the last century, that if you can dream it, you can do it. And that's what I'd encourage each of us to think about. And we've been really wrestling with some incredibly weighty issues over the last few days. And instead of being depressed and kind of overwhelmed by the magnitude, which I think is really easy to do given how complicated these issues are, I'd encourage and really challenge each one of us to figure out one way that we can make a difference, one way that where you are right now, you can actually help drive social impact and help make this world a better place. So that's what I've got to share with you, and I hope that we will be able to continue the dialogue in the next few minutes. Thanks.
Hi, Amy. Thank you so much for sharing. And
Absolutely.
I can absolutely feel your passion when you're talking about your project, which is fantastic. So my question is, like a lot of companies these days are thinking about corporate social responsibility and doing the right thing. And I think a lot of the challenges for them is that it's going to hurt their bottom line. And that sort of refer back to what Ralph Nader was talking about yesterday about how corporations sometimes can make the wrong decisions because of profit is the only thing they're thinking about. So just based on your experiences, what have you done to really make sure that this initiative can eventually help with the business and create additional business value for PepsiCo, in addition to the community value that you're creating?
Yeah, I think that's a great question. And it's one that we continue to struggle with every day, because I think across the corporation, we've got a lot of different stakeholders. And every time I've gone and tried to understand what one is looking for, I find out someone else wants something else. So part of it is just getting real clarity and transparency on what success looks like. So for PepsiCo, we were going down the road of health and wellness, and so we wanted absolutely to start building credibility in the space. So corporate reputation, as dirty as that sounds, was a very clear objective from our PR and communications groups and folks who said, hey, we need some good publicity about how we as a company can actually make a difference. So that was part of it, right? And there was a media strategy that followed and things like that. Then our sales team said, hey, we've got a lot of challenges in lower income communities, particularly in minority communities, where we don't really understand how these communities work. We don't have the same level of facility. Can you help us understand what it means to co-create with communities and to develop partnerships and trust and equity? So that was another metric. So I think your point is absolutely right. It's always an ongoing process. I think from an environmental sustainability process, we've probably seen the most, the best ROIs in the space. So moving fleets from, gas guzzling trucks to electric and hybrid saves a ton of gas, and it's very clear how you measure that and what that looks like for the bottom line. So I think as all of these initiatives continue to evolve and start to scale, that'll be the real challenge, to understand what the bottom line looks like, how do you define the right metrics, and how do we demonstrate that we are adding value, both in the short term and in the long term.
Steve Goldfuss, MIT Biological Engineering, 2013. This is a really fascinating topic to me. It's kind of an interesting coincidence. The biological engineering department at MIT used to be food science, and kind of took a few twists and turns. So I'm wondering what role nutrition research plays in the decisions you make. You mentioned getting people to eat more fruits and vegetables. There's certainly some correlations that can be teased out there. though when it comes down to getting people to be healthier in terms of reducing obesity, metabolic dysregulation, it's a simple prescription, more or less, of eat less.
Yeah.
Sort of what people do you have working with you from the science end? What would you like to see more of in terms of getting the right information? What are you doing about it?
Yeah, I think your point is a great one. I mean, the basic equation of calories out is a really straightforward one. We all understand it. We have for decades. I think our challenge is not on the nutrition science side, really. So we have a tremendous number of PhDs and nutrition scientists. We work very closely with the USDA and the government and the First Lady's office on some of her Let's Move initiatives. But the biggest challenge that we face, not just in my project, but I would say in the overall enterprise of transforming PepsiCo into a healthier company, is understanding from a consumer perspective how we really motivate healthier behavior. It's probably one of the spaces where there is the largest dissonance between what people know they should do, what people say they want to do, what sometimes people even say they do, and what they actually do. So we've really struggled because we can create any product in the world, and we have, and I've seen them in our labs. But our biggest challenge is trying to convince consumers that healthier products, whole grains, fruits and vegetables, dairy, can actually taste good, and motivating that sort of action at the shelf. And so a lot of our research in our space now is more on behavioral economics, on nudge type things, where you're saying, well, how do I get people to incrementally make that slightly healthier decision? And it's not a transformation overnight. It's just, oh, I might take a diet soda instead of a regular. I might drink water instead of a soda. I mean, it's very, very small steps that we believe can add up to a huge difference. But there's a long, long road to go, and I think that's one that corporations haven't quite cracked the code on. Other questions, thoughts? All right. Great. Thanks.